we can actually draw that air in through our nasal cavity, or we can draw it through our oral cavity. Either way, it's going down towards the same place. The way we're really supposed to breathe is through our nose. And we do that because we have structures in place here that can actually help clean out and purify the air before we bring it down into our lungs. So let me explain. If we breathe air in through our nose, it first passes through the external nares, or nostrils essentially. We have nose hairs there that can filter out some of the larger dust particles that are floating around in the air. That air then goes into the nasal vestibule, and from there it passes into the nasal cavity. And in the nasal cavity, we pass through and swirl that air around these turbinate bones. Think of turbinate like a turbine engine swirling round and round and round. And what we have here are the superior nasal concha, the middle nasal concha, and the inferior nasal concha. Superior, middle, inferior nasal concha. And underneath each one of these, we have a superior meatus, a middle meatus, and an inferior meatus. So again, as air swirls past this area, it's very vascular, so it helps to warm the air. It's mucus lined, which can trap any small dust or debris particles that made it this far. And it's also humid in there, right? There's moisture. So it helps to, again, humidify, purify, and basically clean that air out before we bring it down into our lungs. This is the route that we're supposed to breathe in. If we don't breathe through our nose and we breathe through our mouth, then of course we pass the lips. You'll see the orbicularis oris muscles right here. We'll pass the teeth and we'll go right through the oral cavity. And as we pass through the oral cavity, again on this model, you can see structures like the tongue, the fibrous septum, and underneath the tongue you'll see more muscles. We have the genioglossus. Genion means chin, glossus means tongue, so genioglossus is here. You can see geniohyoid. Again, genion is chin, hyoid is with reference to the hyoid bone that you see here. Geniohyoid and mylohyoid. So genioglossus, geniohyoid, mylohyoid muscles. Again, air would be passing through this way. Either way, air is going to be brought back to this region here, and it is going to go down the trachea. So what we have here, again, is the hyoid bone. We also have the thyroid cartilage. Thyroid cartilage comes from the term thyroides, meaning shield-shaped, because this is a shield-shaped structure that essentially is protecting your voice box. If I remove this, we see a few more structures here. We have the epiglottis, we have the coracoid or the cricoid cartilage, and then of course the trachea itself. This is where air will be passing down. We also have other structures on this model that are worth pointing out. Behind our forehead, we find the frontal sinus. Posterior to that, deeper inside, we have the sphenoidal sinus. Right here, we have the opening to the pharyngotympanic tube. That's essentially where our ear ties in with our throat or our nasal cavity at this point. And we also have other structures in place. We have the pharyngeal tonsil, sometimes called the adenoid. We have the palatine tonsil at the back of the palate. We have the lingual tonsil at the back of the tongue. This is paired right and left. This is paired right and left. And this is the adenoid is a solitary piece of tissue. If we look at this right here, this region right here, the structure right here, is what separates our nasal cavity from our oral cavity. We call this the palate. If you take your tongue and push to the roof of your mouth, you'll be touching your hard palate. The hard palate is just that. It's hard. It's made of bone. In fact, you can see at this point we have the maxillary bone. There's a tiny little suture right here. Posterior to that, we have the palatine bone. Beyond that, at the back of your throat, we have the soft palate. And the soft palate is made up of muscle tissue, as well as a structure called the uvula. If you open your throat and say, ah, you'll see your uvula dangling back there. We also have different regions. This region is called the nasopharynx. Nasopharynx is easy to remember. It's the region posterior to the nasal cavity. We have the oropharynx. Again, oropharynx is relatively easy to remember. It's at the backside of the oral cavity. We have the laryngopharynx. Your laryngopharynx, of course, on the backside of your larynx or your voice box. Now, when we chew and swallow, what ends up happening is the swallowing reflex kicks in. Your tongue essentially pushes up to the roof of your mouth. Your uvula flings back here to close off the nasal cavity. And this structure right here, the epiglottis, epi means upon, so the epiglottis, what it does is it actually folds over. Wow, how cool that is. So when this folds over, what we're doing is we are preventing food stuff from going down our trachea. That's what happens when somebody chokes. But normally, this folds over and directs food, saliva, liquid, whatever it is, all the way down the esophagus. The esophagus is what you see here, running all the way down to our stomach. One last structure you'll see as we get all the way down to the bottom here is a cross-section of the thyroid gland. And if I pull on this little string here, you'll notice what happens. Oh my goodness. Wasn't expecting that.